Welcome to Interdisciplinary Case Miles, a podcast where real runner stories meet clinical expertise. We discuss real cases that are anything from weekend warriors all the way to elite athletes, while using our evidence-informed approach.
I'm Dr. Sara Raiser, a running medicine physician focusing on helping runners prevent and recover from running-related injuries while optimizing health and performance.
I'm Kelsey Pontius, a sports dietitian helping runners to fuel smarter, recover better, and help avoid the risk of injury so that they can meet their goals.
And I'm Dr. Mihevc Edwards. I'm a physical therapist and orthopedic specialist, and I've been treating for runners for over 15 years. And what I do is help them get back stronger and better. Hey everybody, welcome back to Interdisciplinary Case Miles. We are on a little binge recording right now, and we are doing a couple of our recordings tonight. We're so excited to bring you this case because this is something that I've actually seen quite a few times, and we've all seen before, but it's something, again, that people don't always know what to do with. And in fact, when I was a young PT, I didn't really know what to do with this either. So what we're going to talk about is a 17-year-old high school male track athlete. And this athlete is presenting in the clinic with a little bit of abdominal wall pain and a little bit of groin pain. So the pain is kind of, I would say, in the lower quadrant of the abdomen. So if you think belly button, go down and then pick a side. And then it's there. It's a little bit into the thigh, but definitely into like the adductors or inner thigh and groin. And this athlete does soccer at a I'm sorry, not soccer. Why am I saying soccer? Oh, because my son plays soccer. Sorry, guys. This athlete does track, and he's pretty high level for a high school athlete. So he's really putting everything into his training. And it's something that really anchors him. I think it's important to say and talk about the mental health aspect of some of these cases, or all of these cases really, is that this athlete really identifies as a runner and a track athlete, and he's very afraid that because of the pain that he's having, that people have kind of shaken their head and said, I don't know what that is, that he's not going to be able to do the sport that he loves anymore. The symptoms are kind of tight and aching and intermittently sharp, but not really. That's not the main thing that he's describing. It's more just pulling, tightness, discomfort. He can't really get his leg back into full extension. He doesn't feel like his stride is really long. So we're going to start with that. And I want to kind of talk about things that I want Sara to actually talk about, some things that we're ruling out. So there are many things that this could be, but there's definitely this area and a thing that kind of comes up about hernias all the time. So I want Sara to dive into that first, if you don't mind.
Yeah, so pain in this region can overlap with a lot of regions, and it starts oftentimes getting out of folks' comfort zones when you're going to see a musculoskeletal specialist. They start thinking like, oh, is this abdominal? Do I need to worry about something else? And the answer is yes. You need to make sure that there's not something going on in the pelvis that's more visceral or more organ related. Definitely for men too, but especially for women with more of the reproductive organs that are in that space as well. So thinking a little bit outside the box of the musculoskeletal specialist. Other things that we think about in this area. So your inguinal ligament runs through this area. It's kind of what you can palpate in the crease between your leg and your pelvis. And one thing that can happen in that area, usually in a little bit older age group, is that you can get what's called an inguinal hernia. There's also femoral hernias, but basically a hernia is where the fascia or the thick connective tissue gets a defect in it. And so you can have tissues that actually bulge through that defect. And when you cough, sneeze, have a bowel movement, anything that increases your abdominal pressure, it can push those tissues out through that space. And that could be, as little as just some discomfort all the way up to having intestines and other organs that actually push into that space and can potentially be an emergency. So when we talk about this particular issue, we're talking more into the sports hernia type picture, which is actually not truly a hernia, but we are talking about injury to all of those really thick connective tissues. So we think about all the abdominal wall muscles turning into tendons and these big layers of aponeuroses that roll up together. You've got your adductor tendons that come down from the inside of the thigh and come all the way up into the space. And so you've got a lot of different structures that are all coming together. And these are structures that don't have really great blood supply. So these are, because of that, it makes it hard for them to heal well. And it's a very intricate structure. So thinking like, oh, well, there's a defect in the tissue, we just fix it. And just fixing it is not very easy to do. And as Kate alluded to, and as she's talking, I'm thinking like, oh yeah, I remember this type of runner is like, we're talking about someone who's probably really putting in the miles and they're doing a lot of work. And are they getting the recovery? Are they getting nutrition they need? Are they taking rest days? Are they sleeping? Is this someone who's in their senior year and they're like, I want to be so much better, so I'm just going to do more, which we oftentimes learn the hard way. More is not necessarily the way to do it. And usually it's simply the way to get injured and kind of go over your injury threshold. So coming back to this, we think about organs, we think about, could this be an inguinal hernia, which potentially is going to be surgical, depending on the size. This can be a sports hernia, and this can also be groin stuff going on in the hip joint or tendons crossing the hip joint. So we've got a lot of things to think about. Kate alluded to the fact too, maybe this athlete's seen a bunch of other providers, so maybe they've ruled out femoral neck stress fracture. They've ruled out that this is FAI or a labral tear, or an injury to the pubic symphysis, so the connecting joint in the very front of the body. And so now we're coming down to, well, what in the world is it? Now you can get an MRI of this area and see nothing. And number one, you may see nothing, and that's just the way it is because the changes are so minor. But you may also need to get a very specialized MRI that has a protocol for athletic pubalgia where they do really thin slices through that space. So it's also, you have to have a physician who actually has, they're already thinking about this to order the protocol correctly to pick up on injuries in this area. It's not usually the first thing I jump on in terms of the imaging because we'll say, oh, great, that's what it is. And then we're going to do the PT and all the conservative things. Surgery is absolute last resort, and it's very complex and only a couple of specialists in the country. So we very much treat this conservatively. And I think this is where we start bringing in all of our holistic approach. So checking on our nutrition, checking on our recovery, our sleep, our rest. What are our goals? Where are we? Where's the headspace? And this is a person that can oftentimes be really hard to rein in. And as you rein them in, they might lose a lot of the things that we're helping to stabilize them with their high volume activity. So, did you want to add anything, Kate?
I thought that was great. I mean, I'll always add, I just talk all the time, but you, I think that you really outlined that really well. And what I really liked that you said was that they can get an MRI and see nothing. And I want to really point that out because that is the case with so many issues, so many injuries, and especially this area. And if someone is, a lot of the athletes that I see that have this, that have seen a lot of people already, they are in the headspace where they're really stressed out and they want an answer. And then when they think getting the MRI will solve the problem because it will give them this definitive answer. And almost always it doesn't show anything. And then that can create a spiral from like a mental health standpoint. And I think it's important we talk about that because, and we talk about that to our patients before we send them for MRI or before they have that imaging so that they can be prepared to know that it may show nothing. And if it shows nothing, it's okay. Because with cases like this, what I would do once I know that all that other stuff is clear, and we really think that it's this abdominal wall pain, probably labeled sports hernia, although I still don't think that's a good name for it. What I would do is I would look at how is their hip flexor mobility, how's their adductor mobility, how's the strength of those muscles, what is their breathing pattern like, do they have trigger points in their abdominal muscles, in their obliques, or their rectus abdominis, what does their thoracic spine mobility look like? Thoracic spine mobility, and again, that kind of posture when you're running is very important for something like this. You have to address that thoracic spine in order to make this improve, just because of all of the attachments. And again, the other piece that I really liked that you said, Sarah, is that you were describing the anatomy and how even the adductors kind of come up and how everything is so intricately wound up in that area. And the reason that I like you said that is because people will say, well, I don't get why it's in my abdomen, but it's also in my groin. And it doesn't make sense that it's in both places. Well, referral patterns don't always make sense. And that's okay. So it's okay, but there are reasons behind it. So a lot of us know what these referral patterns are and can explain it when asked. But sometimes it doesn't make sense. Sometimes it's referred from a nerve. Sometimes it's referred from a trigger point. Sometimes it's referred, and we'd call it somatic pain. There's so many things that could refer and be happening at once. And so I just think, again, a lot of the management around this, around a patient like this, is expectations and understanding, figuring out what their goal is and how we can reach it, and then making sure from a PT standpoint, we're looking at thoracic spine, breathing, abdominal wall, adductors, hip, glutes. I'm still going to look at their foot because I always do, just because I think about like from the gait cycle, what's happening. And I'll be also looking at their arm swing, but just in general, those are the things that I would really feel are important. And I think this is kind of where you, Kelsey, could come in as well, because if we're really talking about the mental health component of this patient and kind of what's happening and how we're spiraling, and some of the things that they might do during this time, if they can't run the way that they want, they might try to control things in other ways.
That's a big theme is, okay, I can't control the trajectory of my injury recovery and how soon I can get back to sport and the way I want to get back to sport. So I actually see it in two different areas that kind of impact each other. So I see, we're going to control the amount of nutrition that we're going to have. So we're going to restrict food. And sometimes it's not as voluntary. It's just that we are cross-training and we know how much nutrition it might take to run a certain mileage, but it's hard to extrapolate that to cross-training or cycling or being on the elliptical, which our watch might say we need one thing, or a smart device might say we need one thing, but it's a new movement pattern. So it's putting a different stress on our body, or it's bringing our body through a different type of force, which is hard to quantify. And then the other piece of it too that I see a lot is we can't control our running and we can't control our training. So we are going to over cross train now. And so we are just going to get more fit, or we're trying to emulate exactly our run training through cross training. And I think that's a little bit acceptance too of like, hey, this is actually an injury that's super appropriate to take some downtime for. And if it is a setting, like you were saying, a very successful high school runner, then they might have the pressure of college on them and want to do more. Now I need to do more than what I was doing. Or there's crazy information out there of how much cross training you need to do to match running that gets us in trouble, right? And so that can increase the demands, the nutrition demands. And so I think that, one thing that I try to do with my clients that are undergoing injury is making sure that they realize to heal an injury in a soft tissue context or in a bone context, that is a anabolic process, and that the body has to lay down new cells so it can lay down new tissues and kind of follow that cycle of injury healing and healing cascade that really requires nutrition, and is really fascinating how nutrition plays into that. So making sure that they're eating enough, making sure that, whether it's bone or soft tissue, there is an increased need for protein, but not at the expense of restriction of carbohydrates, that they're eating enough carbohydrates to match the amount of cross training. Hopefully it's an appropriate amount of cross training. And then, I think one of the big things that I see, and actually it took me a long time as an athlete that trains with men to understand what was going on and think of this as a red flag, because as a female, if someone's body size changes from season to season, then a lot of times people are concerned. But the way they talk about a man's body changing a lot of times is, oh, that athlete is fit. And I think that it just takes more awareness and more education that if there's been dramatic changes to body size, then something is unbalanced, whether it's the amount of training or the amount of nutrition or a combination of both, that we need to address. And that certainly puts them at higher injury risk when we see those dramatic changes. Also, I think that we think that, it's only happens to female athletes, but I have worked with a number of male athletes, and I think that sometimes because that is the story, they don't get the support that they need, and they don't feel as comfortable talking about it.
Yeah. I'm so glad you brought that up. That's exactly right. And I think that we separate as athletes nutrition sometimes with injury, or we put them in different buckets maybe, where we
Yeah.
think that, and oftentimes we don't, because we think about, a lot of times athletes are thinking about their nutrition all the time. But with athletes like this, if they're trying to heal, they need to feed themselves so that they can heal. And I like to tell people that your recovery will take longer if you're not fueling appropriately. So if you're frustrated that your recovery is taking too long, then we definitely need to think about that nutrition angle, because that could be what's holding you back. It could also be stress, or it could be our mindset, or it could be that we're cross training too much, like you mentioned, or that we don't know how to run anymore, like in terms of a return to run or a return to play program. Like how should we be running? What are the guidelines around it? What am I allowed to do? So as practitioners, we really need to give specific instructions and guidance on like how people should be doing things, like how much exercise, how much running, how much cross training, and then giving them a framework to work off of.
I think so too. Oftentimes when an athlete gets injured, there's kind of when it's whose responsibility is it to prescribe the exercise? Is it the PT, or is it the coach? The coach doesn't have the information of what's medically appropriate. So sometimes I feel like they get lost in limbo. So I'm curious, Kate, how you handle that when you have an athlete that's kind of stuck, because oftentimes neither of those areas is my scope of practice. I just see the repercussion. So I'm trying to connect them, like I did last week with my bone stress injury client.
Yeah, I think it's a communication, right? So like we talked about how we'll each talk to each other. So if it's a patient that maybe saw Sara, I would definitely call her and we would talk about it together, about how we might return that athlete. So, I always call the coaches, or I do my best to be in communication with the coaches. A lot of the coaches here will send to us now because of our open communication. But if I don't know the coach, I'll ask the athlete or the parent if we can have the contact information, because it's really important to bring them in. So we're talking, this is our interdisciplinary Case Miles podcast, right? So that means coaches too. And I do think that as medical providers, sometimes we forget about that piece. And it's so important that we're talking with our coaches, because what they know, and they see the athletes all the time. They know what's happening they know about their relationships, and they have a plan and they know their goals. And so if we can communicate with them and work with them, then we can figure out how to meet the athlete where they are.
And I'll play a little devil's advocate here. So with the coaching staff,
Yeah.
In the college setting, there's traditionally the coaching staff, then you have the athletic trainer kind of in between them and the medical team. And so I think that oftentimes, like I was at a recent panel and the college team physician said, well, we really don't ever want to talk to the coach because I want to make sure that I am always staying totally third party. I am not thinking about the game and getting the athlete in the game. I'm thinking about the athlete's health. However, I do think there's so much value in having our coaches in on all these conversations and the education and where our literature is going and the evidence, because the culture is so important and we've got to have everyone on the same page. And so I definitely value a lot of the work that you've been doing, Kate, with coaching, because they should be part of the medical team in that way. I think it gets a little bit tricky because I will frequently offer to talk with coaches, but I always ask permission if it's okay from the athlete standpoint and what they're okay with me sharing, if anything, besides kind of their return plan. So generally that goes through the athletic trainer. I've rarely had a scenario where I've actually spoken with the coach, and that's been the athlete's preference. But I do think that our culture needs to change, and we need to start having everyone on the same page. That support team is so important, especially when we're talking, any level of athlete, but even more especially our adolescents, because that's a tough time, and there's so many peer pressures happening, and adolescents are looking to where are they supposed to get their support, who do they believe, and the more people are on the same page, the more helpful that can be. So that's my soapbox. But I love, Kate, that you're getting involved with coaching, because I think it's so important for us to be on the same page. And there's definitely still sometimes headbutting with the medical team, but I think that we're just on different pages, and we need to better understand what one another is doing so that we can support each other better and our athletes.
Well, I think that I really learned it, from the track club, the team that we kind of built with the track club, because, learning to listen and hearing the perspective and hearing how much the coaches, know about their athletes. And like for a long time, I sat like you, where I would really sit with the athlete and not really think about calling the coach. And that was that was when I was a lot younger. And now what I've found is that as long as the athlete is okay with it, and the parent, and also in the situation, and the athlete feels safe, that it can only help. Because all the coaches that I've worked with and know, or at least I would say most of them, I want to say all, I think it's all, just are really strong advocates for their athletes. And they really are coaching because they love the sport and teaching young people. And so when I go in with that mindset, and part of it is education, and them being willing to be open, and me being willing to, excuse me, guys. And I have to be open as well, because I've learned things from coaches that I was like, oh my God, I've never thought of that before. As a healthcare provider, and it changed my complete perspective. I'm still thinking about tissue healing. I'm still thinking what's appropriate and best for that patient's health. But now I'm framing it in a little bit of a different way, and I'm talking about it differently.
I think too, as someone that has played the part of athlete and played the part of healthcare provider, there's a big emotional component when you're going through an injury. So it almost helps to have an advocate there while you're an athlete that's communicating with a healthcare provider, to be an extra set of ears. And so if a provider says, gives you a prescription of how to go back to exercise, that you're not listening and hearing what you want to hear, and having an advocate that was like, actually, they said this, is helpful, because I've been in the shoes where I've heard what I wanted to hear of, oh, we can do this next week. And it's like, well, they said there's a follow-up if everything is perfect, and everything wasn't perfect.
That's right. And it's true. And then Sarah, I also think that the difference between you and I is that I'm PT. So, and you're MD. And so because of that, I think that there is some, I don't know how to put it, but like, I think it's just sometimes easier for me to approach the coaches as than it would be you, because it's kind of, people see PTs similarly to ATCs, I think, in a lot of ways. So it might be why I bridge the gap a little bit more. And it also might be because of you guys and, the multidisciplinary team we work on at the track club, and this, and I don't know why, but I think that it is harder for you.
Yeah. And I was also thinking too, I think the social aspect is so important. And I try to talk to athletes about that. Like, I get this is going to be hard, and it's hard because you feel like you're letting your teammates down, or, you feel like you're being treated special from other folks. And I think especially if the coach can be on board with that and support the return plan, it also demonstrates that that's okay to other athletes too. And that it's not slacking, it's taking care of your body. And that's what's actually going to set you up for success.
Yeah. Well, that's great, guys. All right, so we're going to start wrapping this up. And before we do our last three things from each of us, I want to do a shout out to our sponsor, Lever Movement Systems, who we love. And I want to say that, you can think about using this body weight system on your treadmill. It can travel with you, by the way. It doesn't have to stay at your house. You can bring it to the gym, which I think is one of the coolest things about this. But this is something that you could do with an athlete who's struggling. They want to have a lot more miles than you're willing to give them. It's a great way to compromise in terms of getting them doing a little bit more without hurting themselves. So I really like this, the lever system for that as well, is to just give the athletes something that they can do and continue to do what they love, but in a way that doesn't perpetuate the injury, if you will. So So thanks, guys. And if you're listening, please check them out. It's levermovement.com. Remember, they are helping us be here. They are helping support us so we can bring you these cases. So we'd love it if you'd support them as well. All right, guys, let's wrap it up here. So what are the 3 things we want to take away from this case? Again, this is the 17-year-old boy who's presenting with abdominal wall pain, maybe some groin pain. We think it's in that kind of sports hernia category. Why don't you start first this time, Kelsey? And then Sarah, you go next.
I would say if you're a healthcare provider or an athlete with teammates, as we all have, or a coach, that underfueling is not isolated to a gender, it's not isolated to a body size. That should always be a question. We should always be asking our athletes, are we fueling correctly, and not making any kind of assumptions based on their appearance.
I love that.
And for sports hernias, I think kind of 2 things. One is getting the right diagnosis, so ruling out other things that could be causing it, and then really looking at loading. So making sure that you're pulling folks back, that you're taking them off of the single leg loading, high impact, to be able to allow for some healing, and recognizing that it's going to take a while, and you've really got to support your athlete from a holistic standpoint, and definitely from that mental and psychological standpoint.
I like that too. You like my creepy sound. You guys
Barry, keep that in.
You guys are so smart. Okay. The last thing that I would like to say is that I would definitely we could definitely treat this athlete. So it's not a lost cause, right? No matter how frustrated they are, once we've ruled out all the scary things, this is not, as you like to say, Kelsey, this is not a unicorn. This happens, this abdominal wall pain in younger guys. And what we would really think about, and what I would want them to make sure that they're checking out, is the thoracic spine, their breathing, their stability. So we would start with double leg strength and being able to control that rotational control, making sure that, their trunk is doing what we want it to do in relationship to their pelvis and their lower extremity. So making sure that we do that, looking at their run gait analysis, and thinking about, again, how are they loading their body, and then finding a way to allow them to continue to train the best that they can and get strong the best that they can for their mental health, but in a safe way. Cool. All right. Well, thanks so much, guys. And if you are listening and you're still here, we're so happy that you're here. And we want to say that if you have a case you want us to talk about, please email us. And the email is runcasemiles@gmail.com. You can email us any questions, any concerns, anything you want. Remember, these podcasts, we're kind of going through everything that we can, but we may leave something out. So if you feel like it's important that something's added, that's fine. Tell us. We want to hear from you. So send us a note, and hopefully we will catch you the next time you're around. Okay. Bye.